I am Dr. Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue salt therapy, part 17, FERRUM PHOS 1. Full name FERRUM PHOS, short name FERRUM. Ferrum means iron. Chemical name of ferrum phosphorica or phosphoricum is phosphate of iron. Mode of action. Iron is an indispensable constituent of human body. Iron is in every cell. Its want makes muscle lax. There are finer muscles in the wall of the artery. When these get lax, arteries swell up. Blood accumulates there. The place is swollen up, becomes painful and red. We call this inflammation. Fine arteries may rupture and bleeding may occur. This bleeding is bright red. If we take FERRUM PHOS, is very fine dose, bleeding and swelling are gone. Again, each cell in our body needs oxygen. Iron carries the same to the cell via blood. When there is want of iron in blood or infection is there, blood movement is increased, temperature is also increased. We call it fever, inflammation. Fever symptoms like restlessness, uneasiness, etc. are all seen due to want of iron. Inflammation has got three stages, first, second and third. Characteristic of each of are the following. One must know this for selection of medicine correctly. First stage. Signs symptoms: sight red, swollen, hot, sore, fever, increment in pulse, pain from touch, better from cold, worse from movement, emitted bright red blood. Restless. Medicine FERRUM PHOS. Second stage. Fluid gathers. That is, fluid gathers in the place of inflammation. Place becomes soft, pricking sensation, uneasiness, emits viscid fluid. Then calamitous medicine. Third stage, wounds form, pus secretes, patient tired, toxic look. This requires silicea or calcareous salve. If emitted blood from any orifice of the body, may that orifice be normal or abnormal, is bright red, mind it, bright red, FERRUM PHOS is most appropriate. Mental symptoms of FERRUM PHOS. Troubles due to much flow of blood in the brain, producing delirium, maniacal mood, talkative, better feeling from application of cold water. Patient furious, excited, elated or angry too much. Indifferent to serious matters, attentive to trifles. Memory weaks, cannot remember events of very recent, forget names of known persons, places. Calcareous also has this symptom. Lie down silently, no sleep for days after, yet feels no words. Delirium tremens, muttering loudly in fever and with calcareous. Same symptoms we get. Head symptoms of FERRUM PHOS. Trigeminal neuralgia. Trigeminal, this is a fifth cranial nerve. This neuralgia has got many names such as tic douloureux, prosopalgia, Fothergill's disease, suicide disease, etc. Actually, this neuralgic pain is possibly the most painful of all pains. Generally, old-aged ladies used to feel sudden excruciating stabbing pain in one side of the face for a few minutes, and it occurs again and again. That is, it remains for 2-3 minutes, it's gone, then again returns, again 2-3 minutes, again gone. Pain spreads out from mandible in front of ear. Inflammation of trigeminal neuralgia is the cause of pain. Actually, this pain is caused by inflammation of the particular nerve. McPhos, calcareous also helps in this disease. Now, let us explain this images. See, this is the root of the trigeminal nerve. It's both sides. It remains. It is a pair of nerve, right side, left side, and the pain when occurs. Look at the face of the ladies. It is so much painful. It is so much painful. That's why it is also known as suicide disease. Possibly, sometimes a few persons have committed suicide out of this disease. So the name has got a suicide disease. It is also the same thing. The here you can see the places where this particular nerve, trigeminal nerve, supplies. It is around eye, actually, in the face area, also in the chin area. The whole face actually is supplied by right side, right cheek, and left side, left cheek. And FERRUM PHOS help greatly in this particular disease to control. Head symptom continuing: throbbing headache, red face with intense pain and fever, scalp sore to touch, pain felt even on drawing hair. Pain is so severe that patient cannot open eyes, pain on vertex and on eyes also. Natrum sulf also had the symptoms, along with vomiting of undigested food particles. Natrum phos is same symptoms. Reddish eyes full of tears, vertigo with bleeding of bright red blood from nose, epistaxis. This epistaxis is called bleeding from nose. Transient relief from cold water. Now, the images are self-explanatory. Just mind this. This place is called vertex, vertex of the head. This epistaxis. These are all normal. Just what I have discussed here. The pictures are set according to that. Eye symptoms of FERRUM PHOS: acute ophthalmia, conjunctivitis. It is also seen in calamine. Eyes burn, gritting sensation, as if there is sand. Ophthalmia during measles, pox, and photophobia. Ophthalmia means, mind it, ophthalmia is generalized eye inflammation. Conjunctivitis is the inflammation of conjunctiva. First stage of retinitis, keratitis, iritis, blepharitis. These all are actually part of the ophthalmia. Retinitis retina, keratitis cornea, iritis iris, blepharitis eyelids inflammation, etc. Styes, inflammation of the hair follicle of the eyelid. Chalazions, inflammation of the oil secreting glands of the eyelids. These are everything first stage. If it is in the first stage, that is just starting, pain is starting, the place is hot, red, then FERRUM PHOS is the medicine. Ulcers on cornea, abscess on cornea, injury to cornea. Note this thing. Corneal ulcers. It may occur from injury also. First stage of injury, FERRUM PHOS is the medicine. First stage of abscess, injury. First stage of the abscess on cornea, in this FERRUM PHOS is the medicine. Ulcer also, if it is in first stage, mind it, FERRUM PHOS always act in first stage. This is conjunctivitis. This is photophobia, that is, a patient cannot look at the artificial light. Styes. This is styes. It is chalazion. This is something else. It is due to inflammation of the hair follicles of the eyelid. This is due to inflammation of the gland, oil secreting glands. To different disease, looks almost same. In both the cases, if it is in the first stage, this medicine FERRUM PHOS acts nicely. Life case: Master Cornor Singh, aged 12 years, has come with his mother, who informed that for last 2-3 months, Cornor had been facing with trouble of vision. To start with, it was during night only. Now he felt it always, banging his feet here and there. Also facing problem in reading and writing. Doctor had an ophthalmoscope. He used to use it to diagnose different systemic diseases. He tested Cornor's retina very carefully for a few minutes and realized that it was not a case of simple retinitis, but a case of retinitis pigmentosa, a genetic disorder. Accordingly, he informed Dr. Cornor's mother to consult an eye specialist, because this particular medicine, this particular disease is beyond the scope of our pathy. It is beyond the scope of our pathy, so he informed this accordingly. Now, I will tell that you may be surprised that how an ophthalmoscope is used by tissue salt practitioner. Yes, ophthalmoscope, mind it, ophthalmoscope may be used by any practitioner, whoever he may be. Maybe he is practicing Ayurveda, maybe he is practicing homeopathy or tissue salt therapy or any other therapy. He can use it because ophthalmoscope have and scope to diagnose different systemic diseases such as diabetes mellitus, high blood pressure, migraine, metastatic carcinoma, systemic lupus erythematosus, ankylosing spondylitis, thyroid diseases, AIDS, and many others. Actually, for these diseases, specific symptoms, rather signs, specific signs appear in the retina, and from that sign, the doctor can say that this person is suffering from this disease, though he may not be, the patient may not be aware of it. So please remember, ophthalmoscope is a very good instrument to diagnose systemic diseases. Now, the pictures or images. This is a picture of eye with different parts in it. Different constituents, such as cornea. Where is cornea? Where is iris? Where is pupil? Where is lens? And where is the retina? This is a simple picture, but it's very important for those who are starting practitioner. This is ophthalmoscope instrument. The doctor is just examining the patient's eye. This is normal retina. This is very important thing, normal retina. Simple retinitis. Simple retinitis is within the scope of this medicine. If this Corno's case was simple retinitis, then FERRUM PHOS would suffice to cure the disease. Yes, if it is simple retinitis, mind this. This is retinitis pigmentosa. That is congenital hereditary disease. That is beyond the scope of our medicine. Not our, many medicine, many pathies, they cannot treat this disease because this is a very difficult, very difficult disease to tackle. With this, the video ends. Please, thanks for viewing and listening. Any difficulties, you please write down in the comment section. I will certainly reply.